Hey everyone, Dr. Amanda Pasciucco here, sex and couples therapist, and someone who spent years helping people untangle the way they feel in their own skin. What if the root issue is not your body's looks, but your limited ability to feel in your body? Not emotionally feel about it, but literally sensing it from the inside. Science has a name for this inner sensing. It's called interoception. It's your body's signal to your brain, reporting heart rate, gut tension, breath depth, bladder pressure, and even subtle shifts in temperature or muscle tone. When this connection is impacted by chronic stress, diet culture, past trauma, or even years of overriding signals to push you through, you lose trust in your own physical connection to yourself. Research studies strongly link poor interoception to body dissatisfaction, eating struggles, anxiety, and even sexual disconnection. The good news though, you can rebuild it. And when you rebuild your body image, confidence emerges as a quiet new superpower. This is my body and I know what it's telling me. That feels amazing. So here's the framework I use with some of my clients. Step 1, inner roll call. 5 or 7 minutes, no judgment allowed. Lie down or sit comfortably. Close your eyes, start at your feet and scan upward. Naming only sensations, not good, bad, fat, weak, flabby. Drop in the comments below what's one sensation you've been ignoring that your body keeps sending you as a signal. No judgment, we're just sharing. Do this daily for 2 weeks. The goal isn't to like what you find, it's just to hear clearly what's happening in your body and to learn what's on the inside. Over time, the brain starts treating these signals as trustworthy data to be more comfortable in your own skin. Share this with someone whose body deserves to be heard, not just looked at. Step 2, the signal to story bridge. Pick one sensation that shows up. Maybe a chronic shoulder pain, lower belly heaviness, maybe like a racing pulse in social situations. When these things happen, ask yourself 3 questions. What does this sensation remind me of that my body has carried already? Maybe the shoulders are hunched because of years of bullying, or the belly expanded to protect during a time of grief. 2, what does this sensation need right now to feel safe? Maybe slower breath, a hand resting there without squeezing, movement that releases instead of punishing. And 3, if this part of me could speak from its own perspective, not the critic, what story would it tell me about survival, not failure? Write down or voice record these answers. An example that I hear a lot: the tightness in my hips held me upright through different job losses, 2 moves, and nights I didn't even think I'd make it through. I need gentle rocking and dancing, not another squat challenge. We need to shift a one-sided monologue of shame to a dialogue where your body gets to co-author the meaning with your brain. That's why I made the step-by-step video on body image changes here. This shift doesn't happen overnight, but after weeks of consistent inner roll call and story bridging, people do report something radical. Their bodies start to feel like evidence of them. They're actually resilient, alive, and they are communicating with themselves. If this lands, try the inner roll call tonight and leave a comment on how it felt. Hit like if you're ready to stop performing, subscribe, hit the bell, and all for tools that go beneath the surface level. See you next week.